It happens hundreds of times a day in this country. The birth of a child to a child.
40 years ago, the public was outraged. It seemed there was a wave of teenage girls, particularly black teenage girls, getting pregnant.
How old are you?
14.
And how old is your baby?
My baby is 4 months.
So this was a new idea, this new deviant class of people, and it was portrayed in these terms that were really not accurate.
Babies having babies.
Babies having babies.
Yeah, broken homes, you know.
Right,
yeah.
the whole thing, and none of that applied.
Arline Geronimus was at the time a graduate student. The prevailing wisdom was that high rates of infant mortality in the black community were because women were having children when they were too young.
I had worked in a school for pregnant teens, and none of what I was hearing and had taken as common sense myself was what I was seeing.
Geronimus looked at the numbers and found that, actually, younger mothers were having more successful pregnancies.
For the black women, the lowest risk ages were in the teens, in the late teens, and then they went straight up, so that by the 20s, and certainly by the mid to late 20s, there was substantially more risk of infant mortality if you had a baby compared to if you were 18 or 19. And by 35, things were off the charts.
How did people react to what you found?
Not very well.
Yeah, I can imagine.
People thought I was promoting teen childbearing. The papers wrote columns where they called it things like "Research Queen says let them have babies." I got death threats.
Geronimus became a professor in the School of Public Health at the University of Michigan, where she teaches to this day. She lowered her profile, but also widened her perspective, examining indicators like the lower life expectancy of black Americans compared to white Americans. She developed a theory that stress caused by racism and other societal pressures contributes to poor health. She named it weathering.
The idea of weathering was connoting sort of how a rock, for example, would be weathered by hundreds of years of rain and wind.
Of course, it's going to affect it.
It's going to affect it.
And wear it down.
Absolutely wear it down. I like the word weathering in particular because it also has another meaning, which is that you weather the storm.
The weathering theory deals with not just length of life, but quality of life. For example, while on average black women outlive white men, Geronimus found that black women faced shorter active life expectancies than white men. That is, black women become disabled at earlier ages. After decades of working on the theory, she's now pulled it all together in a book called, of course, Weathering.
Weathering is the way that racism, structural racism, makes life very hard.
This is not something that just affects people of color, weathering. I think that's an important point that you make. It can be a class issue as well. There's a lot of different factors.
It can be a class issue. It can be a stigmatized group issue. Anybody who's human is capable of becoming weathered and will become weathered to some degree if they're also oppressed or marginalized or suffering endless stressors, whether it's environmental or material hardships or hunger, or whether it's the fact that you're not affirmed or valued and you have to question where you belong and what it's safe to do or say in different situations.
She endured a lot for this work, and we just have to applaud her. Her courage is remarkable.
Dr. Kimberly Dawn Wisdom has spent much of her career putting Geronimus's theories into practice, trying to overcome the impacts of weathering. Dr. Wisdom is the Senior Vice President of Community Health and Equity at Henry Ford Health in Detroit. She was Michigan's first Surgeon General.
The body keeps score.
Day-to-day stress actually changes the body, down to the cellular level, leading to premature aging.
So take diabetes, take hypertension, take cardiovascular disease, infant mortality, maternal mortality. Just multiply the poor outcome by 2 or by 3, and that's what you see in populations of color. So it's like the Caucasian population can catch a cold, but populations of color actually develop pneumonia.
So, for example, the latest studies show infant mortality rates for Black Americans that are more than double those of white Americans. To take on the challenge, Dr. Wisdom founded the WIN Network, which stands for the Women Inspired Neighborhood Network. Expectant mothers are given health care, guidance, and support through pregnancy and beyond, which has led to maternal and infant deaths falling and birth weights rising. Mothers like Courtney Anderson and her third child, Kalani.
8 months. And what was her experience like having her through WIN?
Great. She's a happy baby.
Wow.
Anderson had her first child, Camreen, before she was in the WIN Network. He was followed a year later by his brother, Christian.
Well, my first child, I was I had my hands full, kind of stressed, kind of bummed out, postpartum depression. But by them talking to me and giving people to talk to me and stuff like that, if they're not there for me and stuff, I'm actually interacting more with my kids. I'm more happy with my kids. I get to talk to my kids and be like, hey, woo, type stuff.
And then how do you think that's going to affect your kids?
It's going to affect them really well, and to know that their mom is happy when mom is happy. They have a lot more.
What would you say to people who would kind of maybe blow this off and say everybody has stress, everybody has things to deal with, what's the big deal? Take care of it yourself. Be responsible for your own health.
Right. Yes, people should eat healthy, have healthy behaviors, but yet we see the weathering when we look through the lens of what's really happening in a society. You can do all those things and have a poor outcome. See, the typical narrative is you eat healthy, you go to school, you get a college degree, you have a good life, and you live to 80 or 90.
Right.
That happens with one population. When you find another population that eats healthy, goes to college, gets an education, gets her PhD, and dies in maternal mortality. So
something's wrong
Something is wrong.
So for some people who might feel like the idea of weathering it could be seen as another way of, let's just say, making Black people into victims than not going past that might see that as building in another stereotype.
That couldn't be farther from the truth. Even if you go back to slavery, no one was working harder or doing more. But the people who pronounce on Black people's poverty as self-inflicted because they're too lazy or too irresponsible, they're just wrong.
At the end of the day, it got me thinking about my own family. My parents died in their 70s. 2 siblings died in their early 60s. All of them much too soon.
So much diabetes runs in my family. Unfortunately, cancer, high blood pressure. There were certain ailments that were kind of, I don't know how else to describe it, but sort of expected almost, or that's just kind of comes with the territory. And this says it shouldn't come with the territory.
It shouldn't.
Or the reason it came with the territory was that kind of weathering, that constant.
Absolutely. You've described it exactly. What many people of color families say that, we all get diabetes. We all get cancer. That's part of the natural course of life. That's the life course. That is not the life course.